Good morning, Miss Williams. How are you today?
I'm good. How are you?
I'm good. I'm the pharmacist here. Can I get your address and date of birth?
I was born February 1st, 1946, and I live at 413 Riverbend Circle in Clinton.
Okay. Thank you. Is it okay if I counsel you on your new medication?
Sure, that's fine.
We're just going to make sure that you know how to take it, what it's for.
Okay.
Do you have any medication allergies?
No, not that I know of.
Okay, that's good. Are you taking any other prescription products?
I'm taking hydrochlorothiazide and pravastatin.
Okay. What about any over-the-counter medications?
I take Tylenol for my arthritis.
Okay. Well, this is your Fosamax, 70 milligrams. What
Okay.
did your doctor tell you that this was for?
He just told me it was to help with my my bones, that I have weak bones, and he told me to take that.
Yep. She's going to help with your osteoporosis. She'll strengthen your bones. So you're going to take one tablet by mouth weekly, only once a week.
Okay.
Okay. And you want to make sure that you take it 30 minutes before you eat. So I would recommend taking it right when you wake up. Make sure it's 30 minutes before you eat breakfast.
Okay.
Okay. After you take it, you want to make sure that you sit down for 30 minutes, because if you're up walking around after you take it, it could cause some throat irritation, and that could be very uncomfortable.
Okay.
But yes, this is for osteoporosis. If you miss a dose, you want to make sure that you take it the next morning. Don't take it right after you realize you miss it. You want to take it in the morning, because that's when it works the best.
Okay.
I'd just say that once you miss it, I'd return to your normal routine the next week. Don't take it on that same morning. Go back to your normal routine.
Okay.
Does that make sense?
Okay.
You have a month's supply, so you're prescribed. There's 4 tablets in this package, so you're going to take one once a week, and then you come back and get your refill. You have 5 refills, and once your refills are up, of course, you go back to your doctor, get reevaluated, and then he'll write you a new prescription if it's needed.
Okay.
Where do you normally store your medicines?
I typically keep them in my bathroom, because when I wake up, I just take them.
Okay, well, we're going to want to change that. You're going to want to keep them away from moisture, because moisture can actually mess up the stability of the medication. It can make them go bad, basically.
Okay.
You don't want that, because then they won't work right anymore.
Can I keep them in, like, my kitchen?
Yeah, the kitchen cabinet is best. Somewhere
Okay.
where you won't forget where you put them, but somewhere that's dry, of course. What did your doctor tell you to expect from this medicine?
He didn't really tell me. He just said it was going to help me with my bones.
Okay. Well, I just want to talk to you for a minute about the side effects that could occur. You might see bone fractures, which is rare because we're trying to treat bone fractures, but of course it can still happen. Might experience bone or muscle pain, headache, chest pain or heartburn, and you can have some stomach irritation.
Okay.
So if any of that happens, just let your doctor know. There's no drug interaction, so you shouldn't have a problem with any of your current prescription medications or your over-the-counter medicines. I'd recommend some weight-bearing exercises, but of course low intensity. You don't want to be doing anything extreme. And then also say that your doctor recommended you take an over-the-counter product, your calcium and vitamin D.
What kind of product should I take? Do I take, like, just calcium and just vitamin D, or can I get them together, or what can I take?
It's really up to you. You can get them together, which is what I would recommend, because it's easier to remember to take one pill instead of 2, of course. Your daily recommended dose of calcium to help would be about 1,200 milligrams. Vitamin D about 1,000, really. But here's this product. It has both combined in one.
Oh, okay.
Yep. So each tablet contains 600 milligrams. So you're going to have 600 milligrams of your calcium and then 400 of your vitamin D, give or take. So I'd recommend taking this with your lunch and dinner every day. So you're going to take a total of 2 capsules.
Okay.
Okay. You don't want to take this with your Fosamax, because it can actually decrease the absorption and you won't get the full benefit. So you're going to really be taking it for nothing if you take this with your prescription.
Oh, okay. So I can't take it in the morning?
No, you need to split it up at least 2 hours after you take your Fosamax. So I would just recommend taking it at lunch and with dinner, so you won't have any interactions or problems with it, so you can get the best benefit.
Okay, so when do I take my other medications?
Your hydrochlorothiazide. I would just continue taking those in the morning with your breakfast.
Okay, but not with the other one that I just got?
No. Make sure to separate your other prescription drugs from this product, because it can interact with it.
Okay.
But as long as you're separating it by at least 2 hours, you should be fine.
Okay.
Okay.
I can do that.
Okay, so can you tell me how you're going to take your medicines?
So I'm going to wake up, and then I'm going to take the Fosamax, which I just got, and then I'm gonna sit for 30 minutes and read a book or something, and then I'll eat breakfast, and then at lunch or at breakfast I'll take my hydrochlorothiazide and my pravastatin that I'm already on, and then at lunch I'll take my vitamin D and what was the other one in it? Calcium.
Calcium,
and I'll also take that at dinner, right?
Okay, yes, that's exactly right. So just stick to that routine.
Okay.
If you forget to take one of these at any time, it's really not going to hurt you. This is really just for your benefit. It's not going to hurt if you miss a dose.
So why can't I just take this? Why do I have to take the new one that they just prescribed me? I just want to take the calcium.
Well, both of these together is going to give you a greater benefit than just taking one by itself. Your calcium and vitamin D, if you've ever heard that, it strengthens your bones. That's why you want to drink. They tell you to drink milk and stuff like that because it has this in it, and it's just going to help strengthen your bones. This alendronate is just really keeping them from fracturing since they're brittle. So we just want to prevent the fracture with your prescription alendronate. And then you're just going to build up your strength with your calcium and vitamin D.
Okay, that makes sense.
Okay, so do you have any questions for me?
No, I think I've got it. I think I can take them every day. If I have any questions, I'll just come back in the pharmacy.
Okay, that's perfect. Yes, I'm always here if you have any other questions. Here's your patient pamphlet with your information about your drug on it. If you just want to read over it, it really is just more information about your prescription, which I've really covered. But if you ever forget, you can just look back at that for reference.
Okay.
So thank you, Miss Williams, and just remember I'm here if you ever have any questions.
Thank you.
Mm-hmm.